Most people believe that if something is wrong with the brain, the signs will be obvious. Severe headaches, sudden confusion, a dramatic medical emergency. But here's what nobody tells you. The brain often whispers long before it shouts. Long before a serious diagnosis. Long before a major health event. It sends subtle signals that many people dismiss as stress, aging, poor sleep, or simply having a busy life. I've seen this countless times throughout my career. A patient notices a small change, nothing alarming, nothing painful, just different. They ignore it. Months later, they wish they had paid closer attention. The uncomfortable truth is that some of the most important messages your brain sends are also the easiest to overlook. And that's exactly why today's conversation matters. My name is Dr. Michael Anderson, and I've spent more than 25 years caring for adults facing neurological, cardiovascular, and age-related health challenges. Over those years, I've learned that protecting brain health isn't just about preventing disease. It's about recognizing patterns. It's about understanding the difference between normal changes and signs that deserve attention. Some of the healthiest patients I've cared for weren't necessarily the ones with perfect genetics. They were the ones who listened when their bodies started communicating. Today, I want to share 7 silent signs your brain may be asking for help. Before we dive into those signs, let's talk about something important. Think of your brain as the command center of an incredibly complex city. Every thought, memory, movement, emotion, and decision depends on billions of nerve cells communicating with one another. To function properly, those cells need oxygen, nutrients, healthy blood flow, quality sleep, and protection from chronic stress. When something disrupts that delicate balance, the brain often sends signals. Not always dramatic signals, often subtle ones. The challenge is learning how to recognize them. The first silent sign is unusual forgetfulness that goes beyond everyday memory lapses. Now, let's be clear. Everyone forgets things occasionally. Walking into a room and forgetting why you're there happens to all of us. Misplacing your keys once in a while is normal. In fact, memory slips can be part of a busy life. But here's where things become interesting. When forgetfulness begins affecting daily activities, conversations, appointments, or familiar tasks, your brain may be trying to tell you something. I remember a patient named Linda who repeatedly missed appointments despite always being organized. She blamed stress, and stress certainly can affect memory. But further evaluation revealed untreated sleep problems that were depriving her brain of the rest it needed. Once her sleep improved, so did her memory. The lesson wasn't that every memory issue signals a serious condition. The lesson was that memory changes deserve attention. Have you noticed changes in your memory that feel different from your usual forgetfulness? The second sign is increased difficulty concentrating. Many people assume poor focus is simply part of modern life. Notifications, responsibilities, endless distractions. And there is truth to that. Our attention is pulled in many directions every day. But sometimes, concentration problems can reflect something deeper. Your brain requires energy and efficient communication between its networks. Poor sleep, chronic stress, uncontrolled blood pressure, depression, medication side effects, and other health conditions can interfere with those processes. One retired engineer I treated described it perfectly. He said, "It's not that I forgot things. It's that my brain felt slower getting there." That observation helped us uncover an underlying health issue that needed attention. Have you ever felt like your mind wasn't operating at its usual speed? The third silent sign is persistent fatigue that doesn't improve with rest. Most people view fatigue as a normal consequence of aging, but aging itself doesn't automatically cause exhaustion. The body changes with age, yes, but constant fatigue deserves investigation. Here's the hidden risk. The brain is one of the most energy-demanding organs in the body. When sleep quality suffers, when circulation is compromised, or when chronic inflammation develops, the brain often feels the effects. I once cared for a gentleman who believed his constant tiredness was simply part of getting older. What happened next surprised even him. Testing revealed uncontrolled sleep apnea, a condition that repeatedly interrupted his breathing at night. After treatment, he felt more energetic than he had in years. Were you aware that fatigue can sometimes be one of the brain's earliest distress signals? The fourth sign may be the most overlooked of all: mood changes. Many people separate emotional health from brain health. In reality, they are deeply connected. If you suddenly feel more irritable, anxious, withdrawn, or emotionally flat than usual, your brain may be signaling that something deserves attention. Of course, life circumstances matter. Difficult events affect mood. Stress affects mood. But persistent changes should not be ignored. The brain's chemical messengers help regulate emotions. When those systems become disrupted, emotional changes often appear long before other symptoms. I often tell patients that mental health is not separate from physical health. It's part of it. Were you aware of that connection? But that's only part of the story. The fifth sign involves balance problems and unexplained dizziness. Now, dizziness can result from many harmless causes: dehydration, medication effects, inner ear issues. Yet balance depends on multiple brain systems working together. Small changes in coordination, stability, or spatial awareness may sometimes indicate that the brain needs attention. I recall a patient who felt slightly unsteady while walking her dog. Nothing dramatic, no falls, no pain, just a subtle change. Because she paid attention and sought evaluation, we identified several risk factors affecting circulation and overall brain health. Small symptom, important lesson. Has anything like that ever happened to you? The sixth sign is difficulty finding words during conversation. We all occasionally struggle to remember a specific word. That's completely normal. But frequent episodes that seem unusual for you deserve attention. Language is one of the brain's most sophisticated functions. It requires multiple regions working together seamlessly. When patients tell me, "The word is in my head, but I can't get it out," I listen carefully. Sometimes the explanation is simple. Other times it provides an important clue. One patient noticed increasing difficulty following conversations in group settings. She initially blamed hearing problems. The reality turned out to be more complex. Her brain was working harder to process information because of several health issues affecting cognitive performance. What surprised you most about that possibility? The seventh and final sign is poor sleep. This may sound less dramatic than the others, but don't underestimate it. Sleep is one of the most important maintenance periods the brain has. During sleep, the brain organizes memories, removes waste products, and restores critical systems. Yet millions of people accept poor sleep as normal. They wake up exhausted. They toss and turn all night. They struggle to stay asleep. Over time, those patterns can affect memory, concentration, mood, and overall brain function. One of the most common conversations I have with patients begins with the words, "Doctor, I haven't slept well in years." The next point may be the most important of all. Poor sleep doesn't just affect how you feel tomorrow. It can affect your brain's long-term health as well. Throughout my career, I've noticed a common theme. Most patients don't ignore symptoms because they're careless. They ignore symptoms because they seem small. A little forgetfulness, a little fatigue, a little difficulty concentrating. But health changes often occur gradually, not overnight, slowly. That's why paying attention to patterns matters so much. Now let's talk about what you can do. Start by becoming an observer of your own health. Notice changes without immediately dismissing them. Ask yourself simple questions. Has my memory changed noticeably over the past year? Am I more fatigued than usual? Have my mood, sleep, or concentration patterns shifted? If the answer is yes, consider discussing those changes with your healthcare provider. Also focus on the fundamentals that support brain health. Regular physical activity, quality sleep, social engagement, blood pressure management, healthy nutrition, and ongoing learning. These may sound simple, but their impact can be profound. One patient who taught me a powerful lesson was a retired school principal named Robert. In his early 70s, he noticed increasing forgetfulness and difficulty concentrating. He feared the worst. During our discussions and evaluations, we discovered several contributing factors: poor sleep, high stress, elevated blood pressure, minimal physical activity. Rather than feeling defeated, he decided to make small, manageable changes. He improved his sleep routine, began walking daily, worked with his physician to manage his blood pressure, stayed socially active. Over the following months, he noticed meaningful improvements in his energy, focus, and confidence. The most important lesson wasn't that every symptom can be reversed. The lesson was that taking action early often creates opportunities that waiting does not. If there is one message I hope you remember from today's discussion, it is this: your brain rarely asks for help all at once. More often, it communicates through small changes repeated over time. Those changes may not always indicate a serious condition, but they always deserve your attention. Awareness creates opportunity, and opportunity creates options. Today we've discussed 7 silent signs your brain may be asking for help: unusual forgetfulness, concentration difficulties, persistent fatigue, mood changes, balance problems, word-finding difficulties, and poor sleep. None of these symptoms automatically means something serious is happening, but they are signals worth noticing, understanding, and discussing when necessary. As we wrap up, I want to encourage you to stay curious about your health. Ask questions. Pay attention to changes. Take small steps consistently. Because small decisions repeated over time often shape the future of brain health more than any single action ever could. I'd love to hear from you. Which of these 7 signs surprised you the most? Have you ever experienced one of them yourself? Share your thoughts in the comments below. Your story may help someone else recognize a change they shouldn't ignore. Thank you for spending this time with me today. Take care of your brain. Take care of yourself. And remember, the goal isn't perfection. It's awareness, action, and hope.